Exercise benefits both physical and mental health. Inactivity has a direct link to obesity, which is a major health problem in this country. In results of recent studies, exercise has demonstrated effects comparable to antidepressant therapy in the treatment of depression. Exercise plays a key role in staying healthy. It strengthens bones, heart, and lungs, tones muscles, improves vitality, relieves depression, and helps to improve sleep. It is particularly beneficial to persons with comorbid medical conditions such as diabetes, obesity, and hypertension. Integrative psychiatry includes strategies to improve lifestyle practices such as diet, exercise, smoking cessation, decrease or cease drug or alcohol use, and reduce stress to prevent illness. Client teaching regarding exercise. Check with your provider before starting an exercise program. Begin exercising gradually. Don't expect results overnight. If you're consistent, you will see improvement within 3 months. Work hard enough to sweat, but not so hard that you can't carry on a conversation. Plan an exercise routine that lasts at least 30 minutes and perform the workout at least 3 to 5 days a week. Warming up before exercising helps avoid injury. And include both aerobic and strengthening activities. Exercise modifications will be needed for children, pregnant women, the elderly, obese, disabled, MI survivors, high altitudes, and extreme hot or cold conditions. Monitor the intensity of exercise by measuring the heart rate. The target heart rate during physical activity should be between 60 and 90% of the maximum heart rate. Use the following formula to calculate the target heart rate. So, it's 220 beats per minute minus the person's age equals the maximum heart rate. Then you take that value, the maximum heart rate value, multiply it by the intensity level, and this gives you the target heart rate. Further exercise recommendations. Physical activity at 60 to 70% of the maximum heart rate is considered moderate. The CDC recommends 60 minutes or an hour or more of physical activity each day for children and adolescents. The CDC also recommends 150 minutes of moderate intensity aerobic activity such as brisk walking every week and muscle strengthening activities 2 or more days a week for adults, including healthy older adults. Moderate intensity activities are aerobic activities such as brisk walking, that's minimum once weekly, and to repeat, muscle strengthening activities should be completed minimum 2 times a week. So moderate intensity activities minimum once a week and muscle strengthening activities minimum 2 times a week. The following short section will be about self-awareness and self-disclosure. Self-awareness requires reflection on one's personal beliefs, thoughts, emotions, motives, biases, and limitations, and being aware of how they influence behavior toward others. A trusted person who can give open, honest feedback to self-examination is helpful. Personal experiences influence communication patterns and responses to clients. Social biases, feelings, and beliefs projected onto the client may affect the nurse-client relationship. Being non-judgmental and objective cultivates trust in the relationship. Clinical supervision by a colleague provides ongoing feedback for therapeutic development of the provider, including supporting change as needed. If personal values and beliefs make it difficult to be therapeutic with a particular client, then refer the client to another provider. Self-disclosure. Revealing personal information to the client changes the focus away from the client. When asked personal questions, self-disclosure can be limited by redirecting, giving a vague answer, or reminding the client that you will not share your personal information. Self-disclosure may be therapeutic only when it is purposeful and has an identified therapeutic outcome, such as role modeling. Preventative care and screening practices are essential aspects of the PMHNP role. Screening for physical health problems in the psychiatric client, usually guided by the Healthy People 2020 Department of Health and Human Services, which identifies national health objectives including behavioral health. Mental health promotion and education includes teaching about interventions and ways to cope with specific stressors, validating or normalcy of feelings, ensuring clients that they are not crazy, helping clients recognize and identify their feelings or behaviors, and helping clients identify resources in the community. Public health principles are primary prevention, secondary prevention, and tertiary prevention. Primary prevention in mental health is aimed at decreasing the incidence or number of new cases of mental health disorders, helping people avoid stressors or cope with them more adaptively. Some examples are stress management classes for graduate students, smoking prevention classes, the Drug Abuse Resistance Education Program, DARE, or Keeping It Real elementary middle school curriculum. Secondary prevention in mental health is aimed at decreasing the prevalence or number of existing cases of mental health disorders, early case finding, screening, and prompt and effective treatment. Examples are telephone hotlines, crisis intervention, disaster responses. Tertiary prevention is aimed at decreasing the disability and/or severity of an existing mental health disorder. It includes rehab services, avoidance or postponing complications, and some more examples are day treatment programs, case management for physical, housing, or vocational needs, and social skills training. Risk factors are predisposing characteristics that make it more likely that a person will develop a disorder. We're going to briefly talk on biological, psychological, and social risk factors. Biological risk factors are family history of mental illness, poor nutritional status, or poor general health. Psychological risk factors are poor self-concept or self-esteem, external locus of control, and poor ego defenses. That's psychological risk factors. Social risk factors are stressful occupation, low socioeconomic status, poor level of social integration. Preventative factors are factors that prevent or protect the person from the disorder. Some examples are coping mechanisms or resources that facilitate a healthy response to stress. Biological preventative factors are there's no history of mental illness in the family, good nutritional status, good general health. That's biological preventative factors. Psychological preventative factors are good self-esteem or self-concept and internal locus of control. So the risk factors for psychological risk factors is external locus of control, but psychological preventative factors are internal locus of control and healthy ego defenses. Social preventative factors are low stress occupation, higher socioeconomic status, and a higher level of education. And this concludes the final part of the health assessment chapter recap.